My name is Henrik Zetterberg. I'm a professor of neurochemistry at University of Gothenburg and at University College London. My specialty is fluid biomarkers for Alzheimer's disease and other neurodegenerative dementias. It's a question of global relevance, actually, because these blood tests now become available, and I'm sure when we speak in 2-3 years that we will see that there are a number of clinical chemistry tests for the Alzheimer pathologists that are used in clinical practice. To get these biomarkers out in safe way in clinical practice, we need to actually educate practicing physicians on them, what the biomarkers mean, how they can be used, and how and what it might mean for the patient to have a normal or abnormal test result. This is something I think we also should strive for in close collaboration with the specialists in the memory clinics and neurology clinics and other specialists that could be active in this field. So there should be a strong communication between general practitioners and the specialist clinics that they already now use to refer patients with suspected neurodegenerative disease. It is my hope that we will soon start to think about these blood biomarkers much like we think about other clinical chemistry tests. So for heart diseases, we use troponins. For brain diseases, we could use neurofilament. For liver diseases, we measure proteins that reflect the hepatocytes and also the cells that line the gallbladder and the biliary ducts in the liver. Here we have then that is called sometimes called a liver status test, and we could also have a brain status test like this, having amyloid, tau, neurofilament light, and potentially also GFAP as a biomarker panel that reflects a number of ongoing processes in the brain, to some extent also reflecting different cell types. Learning how the tau, phospho-tau A beta, and neurofilament light and GFAP markers work is not that difficult, but we should and these efforts are happening now, that one should have perhaps short leaflets with information on what the biomarkers mean and how they can be used. The idea here is that one should shorten the time between when a patient first expresses concern until the patient has a diagnosis of what is going on in the brain, and potentially testing of Alzheimer biomarkers and neurodegeneration markers already in primary care, if it's done carefully, could help streamline who should go in, who should be referred more or less rapidly to a memory clinic. And this is especially relevant when in the early phase, when the symptoms are perhaps vague and not that clear cut. And we need to keep in mind that most data indicate that the upcoming treatments are likely to be the most effective in early disease stages. And that is the reason, I think, for why we should try to get earlier diagnosis in place. But that has ethical implications, because if we start to, with the help of blood-based biomarkers, to diagnose Alzheimer's earlier, together, of course, with a lot of other examinations. So it's not a biochemical test by itself. It really has to be a holistic view on the patient and his or her symptoms, together with neuroimaging and potentially more advanced confirmative analysis. And here I think the CSF biomarkers will still play a role. But if we start to give Alzheimer's disease diagnosis earlier, then we have to rethink what Alzheimer's disease is, because then we will have people with early stage Alzheimer's disease. They will still be working, being members of the society, having important roles to play in society, and it would really not be that good if we gave away a diagnosis, basically telling the patient that now it's downhill towards dementia. And but that of course also comes together with more effective disease-modifying treatments. But it's important to talk about these biomarkers and Alzheimer's disease in a different way than we used to, I think.